Hey everyone, welcome back to the deep dive. You ready for a challenge today?
Always.
All right, well today we're tackling a whole stack of medical excerpts all about obstetrics.
That's right, kind of like Obstetrics 101.
Yeah, exactly. From
Right.
placenta to labor, we're going to cover it all. So let's just jump right in. First up, the placenta. I always kind of thought of it as, a simple food tube.
Right.
But these excerpts are saying it's way more than that.
Yeah, it's definitely not just a simple food tube. The placenta is like a whole separate organ system just for the baby.
Whoa, so it's like the baby's lifeline then.
Pretty much. It handles everything. I mean, respiration, waste removal,
Wow.
you name it. Think of it like this. It's the baby's lungs, kidneys, and digestive system all in one.
Whoa, that is wild. Okay, so we've got this incredible placenta, but what about the amniotic fluid? Is that also more than meets the eye?
Absolutely. Amniotic fluid is crucial. It's definitely not just for looks. Think of it as the baby's own little swimming pool, perfect for moving around and developing,
Makes sense.
all while being protected from any bumps or jolts.
That's so cool. So it's kind of like a built-in shock absorber.
Exactly. But get this, it even plays a role in labor, helping to dilate the cervix.
No way.
Yeah.
I had no idea. Okay, so much more going on than I ever realized. Now, there's this term in the excerpts, the lower uterine segment. Sounds a bit technical.
Yeah, it does, a little bit. But it's a really key player in childbirth for both vaginal and cesarean deliveries.
Gotcha. So what's so important about it?
Well, think about it. It's the area that needs to stretch and thin out to allow the baby to pass through the birth canal. And for C-sections, it's where the incision is made.
So location is everything, even in the uterus. Now, this is where it gets even cooler, fetal circulation. We all know babies don't breathe air in the womb. But how does their blood get oxygen?
That's a great question. So the fetal circulatory system is totally different from ours. It's amazing how it's perfectly adapted for life in the womb.
Totally. Okay, walk me through it.
Well, since the baby's lungs aren't working yet, there are these special shunts and bypasses that allow oxygen-rich blood to flow straight from the placenta to the baby's vital organs.
Wait, shunts and bypasses. Sounds so complex.
It is pretty wild. Like, one of them is called the ductus venosus, and it lets blood bypass the liver.
Wow, so the liver's basically on vacation until birth.
Pretty much. And then there's the foramen oval, which allows blood to flow between the heart chambers directly.
So it's like the baby has these temporary detours set up.
Exactly. It's all incredibly efficient, making sure that oxygen gets where it needs to go until those lungs kick in.
The human body is so incredible. Okay, on to another fascinating thing, the fetal skull. So we all know about that soft spot on a baby's head.
Right, right.
But I never really thought about how flexible the whole skull is.
Yeah, and that flexibility is absolutely essential for childbirth.
It is.
Oh, for sure. The bones aren't fully fused yet, so they can actually overlap a little bit as the baby makes its way through the birth canal.
That's amazing.
Yeah, it's called molding. Pretty amazing how the body works, right?
So that explains why some babies are born with kind of cone-shaped heads.
Exactly. It usually rounds out pretty quickly, though.
Good to know. Okay, so let's move on to, I guess, the incredible transformations a woman's body goes through during pregnancy. It's literally building a human from scratch.
It's amazing, isn't it? And the changes are just, wow.
Yeah, what's the biggest one, would you say?
Well, one of the most dramatic is the increase in blood volume. Did you know it goes up by almost a third?
No way. Why so much extra blood?
It's all about supporting that growing uterus and placenta. Got to make sure everything's getting enough oxygen and nutrients.
Makes sense. Does that mean the composition of the blood changes too?
You bet. Red blood cells increase, for sure.
Okay.
But the plasma volume goes up even more, which leads to something called physiological anemia of pregnancy.
Uh-oh, that sounds scary.
Oh, it's actually totally normal.
Okay, got
It just means the red blood cells are a bit diluted by all the extra plasma.
Oh, so it's not that there's less red blood cells, just more of everything else.
Precisely. And speaking of more of something, we can't forget about the swelling that often comes with pregnancy.
The infamous swelling, yeah.
Right. And I know it can be a concern, so it's important to distinguish between normal swelling and something that needs attention.
So is all swelling normal? Or are there some warning signs?
Some swelling, like in the feet and ankles, is super common and usually nothing to worry about.
Yeah.
But if you notice sudden or excessive swelling, especially in your hands or face, that could be a sign of preeclampsia, which is a serious condition.
Got it. So swelling normal to a point, but definitely worth getting checked out if it seems off.
Yeah.
Now let's talk about how pregnancy is actually confirmed.
Yeah, good idea.
What are the main giveaways?
Well, the classics are a missed period, nausea, breast
The
tenderness.
usual suspects.
Exactly. But those can be caused by other things too, so they're not foolproof.
So how do we get that definitive confirmation?
That's where pregnancy tests and ultrasounds come in. Pregnancy tests detect that HCG hormone in either urine or blood.
Okay.
And with ultrasounds, we can actually see the gestational sac and eventually the baby's heartbeat.
That's amazing. Like actually seeing the baby in there. Wow. No, I noticed the source material talks about specific pelvic measurements, like the diagonal conjugate. Why is that so important?
Ah, good catch. So the shape and size of the pelvis can definitely impact childbirth. The diagonal conjugate helps us assess the pelvic inlet.
Oh, why?
The pelvic inlet, that's basically the entrance to the birth canal. So we're making sure it's big enough for the baby's head to pass through.
Okay, so it's like checking the doorway before moving in furniture.
Good analogy. Now, there's this thing called caput-succedaneum.
Ooh, that's a mouthful.
I know, right?
Yeah.
But it's actually pretty common. It just means there's some swelling on the baby's scalp at birth from the pressure of labor.
So it's not a big deal then.
Not usually. It usually goes away on its own within a few days.
Phew, that's a relief. Babies are so resilient. All right, let's talk antenatal care. What are the essential checkups and advice pregnant women should expect?
Antenatal care is all about those regular checkups throughout pregnancy. It's how we monitor both the mother and baby's health.
Right.
So we're checking blood pressure, weight, urine, listening to the baby's heartbeat,
Gotcha.
and of course, offering advice on nutrition, exercise, and vaccinations.
So like a regular tune-up to make sure everything's running smoothly. Now, what about those specialized procedures I've heard of, like amniocentesis?
Yeah, those are usually done when there's a concern about potential genetic abnormalities or other health issues with the fetus.
Okay.
It involves taking a sample of either amniotic fluid or placental tissue to run tests for specific conditions.
Wow, that's like a diagnostic deep dive. Okay, now on to the main event, labor. What actually triggers it?
Well, the exact trigger is still a bit of a mystery. Yeah, but we think it's a combo of hormones and mechanical factors. Essentially, the baby is ready, the cervix starts to soften and dilate, and then the uterus starts contracting to push the baby out.
Wow, so it's like this perfectly choreographed dance.
In a way, yeah. But of course, sometimes the choreography goes a little off script.
Meaning?
Well, labor doesn't always go as planned, and complications can happen.
Like what?
Well, one of the most serious is postpartum hemorrhage, which means excessive bleeding after the baby's born.
That sounds terrifying. Is there any way to prevent that?
Yeah, so active management of the third stage of labor is really important. This means we give meds to help the uterus contract.
Yeah.
And we make sure to carefully inspect the placenta to make sure it's all there.
Proactive measures to keep everyone safe. Now, what if labor needs a little encouragement? What's involved in inducing labor?
So inducing labor means we use either medication or techniques to get those uterine contractions going.
Yeah.
There are a few ways to do it, like using medication or even artificially rupturing the membranes.
So it's like giving labor a little jump start.
That's a good way to put it.
The source material also mentions a Bishop score. What's that all about?
Ah, the Bishop score. That's a system doctors use to assess how ready the cervix is for labor. It helps us choose the best method and timing for induction so we can increase the chances of a successful vaginal delivery.
So like checking the ripeness of a fruit before you pick it.
Exactly. Now, let's dive into some scenarios that can make labor more complex,
Okay.
like shoulder presentation or breech presentation.
So if the baby isn't head down.
Exactly. In a shoulder presentation, the baby's shoulder comes first instead of the head.
Oh, wow.
And in a breech, it's the baby's bottom that's trying to come out first.
I imagine that can make things difficult.
It definitely does. Both situations can increase the risk of complications, and sometimes a C-section might be the safest option.
Right. So sometimes a C-section is the best way to go. What about VBAC, vaginal birth after cesarean? Is that always the possibility?
It can be, but it really depends on a few things, like the reason for the previous C-section, the type of incision that was made, and the mother's overall health.
So it's a case-by-case thing?
Absolutely. It's something to discuss with the healthcare provider to see if it's a safe option. Now, what about the time after the baby is born, the postpartum period?
Right.
It's not all sunshine and roses, is it?
Well, it must be a huge adjustment, both physically and emotionally.
Yeah, the body's going through so much to recover from pregnancy and labor.
So it's like a whole body reset button, but maybe a bit more complicated than that.
Exactly. There are tons of changes happening. The uterus shrinks back down, the bleeding gradually decreases, hormone levels go through a roller coaster,
Wow.
and often new mothers are starting to breastfeed.
Speaking of breastfeeding, how does that even work? It's amazing how the body just starts producing milk.
Right. Lactation is incredible. It's driven by hormones.
Which ones?
Prolactin's the one that stimulates milk production.
Okay.
And then oxytocin kicks in to trigger the release of milk from the breast.
Teamwork. Are there any common reasons why breastfeeding might be difficult?
There can be, unfortunately. Latch problems, sore nipples, not enough milk supply. Those are some common ones.
Oh, man.
But the good news is there's a lot of support available. Lactation consultants are amazing and can help with all of those things.
Okay, so help is out there. Now, just like during labor, complications can also pop up after birth, right? What should new moms look out for?
Yeah, definitely. One of the big concerns is puerperal infection, which basically means a postpartum infection.
Yikes.
It's important to keep an eye out for any fever, unusual discharge, or pelvic pain, and get checked out right away if anything seems off.
Got it. So signs of infection, always a red flag. What else can happen?
Urinary problems like pain or difficulty peeing, and blood clots are also potential complications.
What clots? In the legs?
Yeah, usually. It's called venous thrombosis. But again,
Oh.
early recognition and intervention are key.
Makes sense. Postpartum care seems like a whole other ballgame. Now let's shift gears and talk about some complications that can happen during the pregnancy itself, starting with ectopic pregnancy. What exactly is that?
An ectopic pregnancy happens when the fertilized egg implants outside the uterus, usually in the fallopian tube.
Oh, wow.
And it's a serious situation because it can be life-threatening.
So it's a case of being in the wrong place at the wrong time.
Yeah, that's a good way to put it. It needs immediate medical attention.
What are the signs of an ectopic pregnancy?
Things like abdominal pain, vaginal bleeding, even shoulder pain.
Shoulder pain.
Yeah, it can radiate up there. And if the fallopian tube ruptures, it can cause major internal bleeding and shock.
Oh my gosh, that sounds scary.
It is, which is why early diagnosis is so crucial.
Agreed. Now, what about hyperemesis gravidarum? I know it's like way worse than morning sickness.
It is. It's extreme nausea and vomiting that can lead to dehydration, malnutrition, and other complications.
So it's like morning sickness on steroids?
Yeah, pretty much. And sadly, we also have to talk about miscarriage, which is a difficult but unfortunately common experience.
It is, and I'm so sorry for anyone who's gone through that.
Miscarriage or spontaneous abortion is the loss of a pregnancy before 20 weeks, and it can be devastating, both physically and emotionally.
I can only imagine.
I
Are there
am.
different types of miscarriages?
They're classified based on when they happen and the symptoms. There are threatened miscarriages where bleeding occurs, but the pregnancy might continue.
Oh, wow.
Inevitable ones where the cervix has started to open, and complete miscarriages where all the pregnancy tissue is expelled.
It's so complex. Are there any other complications that can come up during pregnancy?
Oh, there are a few others, like cervical incompetence where the cervix starts to open too early,
Oh, no.
RH incompatibility, which is a blood type mismatch between the mother and fetus that can cause issues for the baby.
I've heard of that one.
Yeah, and then there's multiple pregnancies, which also come with a higher risk of complications.
So basically, pregnancy is a beautiful and natural process, but it definitely has its share of potential complications.
That's a good way to put it. Knowledge and awareness are so important.
For sure. And that's why we're doing these deep dives, to give you the information you need to make informed decisions about your health.
I agree. Being informed is so powerful.
Now let's talk about multiple pregnancies. Twins, triplets, more. What makes those pregnancies so challenging?
Well, carrying multiples definitely ramps up the risk for both the mother and the babies.
How so?
Preterm labor, preeclampsia, gestational diabetes, even problems with fetal growth are more common with multiple pregnancies.
Got it. So it's considered a higher risk pregnancy then?
Definitely. It requires specialized care and really close monitoring throughout.
Okay, that makes sense. What are some specific challenges doctors face when managing these pregnancies?
Well, you're essentially juggling the needs of multiple fetuses while also making sure the mother is healthy. So monitoring fetal growth, amniotic fluid levels, and the mother's overall health is crucial.
So it's like a balancing act.
Exactly. And then there are the decisions about timing and delivery method, which can be tricky with multiples.
Yeah, I can imagine. And of course, there's a higher risk of complications during labor and delivery, too.
Right. Now, one specific concern with identical twin pregnancies is twin-to-twin transfusion syndrome.
TTTS, yeah. What exactly is that?
It's a rare but serious condition that can happen when identical twins share a placenta.
Oh, wow.
It's basically an imbalance in blood flow between the twins. where one twin gets too much blood.
Like they're hogging it.
In a way, yeah, that's the recipient twin. And
Yeah.
the other twin, the donor twin, doesn't get enough.
Oh, no, that sounds really dangerous.
It can be. And the signs can include a big difference in amniotic fluid levels between the twins, a big difference in their sizes, and sometimes even signs of heart failure in the recipient twin.
So how do doctors treat that?
It depends how severe it is. They might drain some of the extra amniotic fluid, use lasers to seal off connecting blood vessels, or in some cases, even terminate one twin's pregnancy to save the other.
Oh, gosh, that's such a tough decision. Now, you mentioned another complication earlier, vanishing twin syndrome.
Right. So that happens when one twin disappears during the pregnancy, usually early on in the first trimester.
That's so sad.
It is. It's basically a miscarriage of one twin, and the body reabsorbs the tissue.
Wow. So it often goes completely unnoticed.
Exactly. It's usually picked up on an early ultrasound when they see two gestational sacs, but then only one develops.
So it's like a silent loss, in a way.
Mm-hmm.
Now, I know there are identical and fraternal twins, but are there other types of twinning?
There are a few. Identical twins or monozygotic twins happen when a single fertilized egg splits into two.
Okay.
Fraternal twins or dizygotic twins are when two separate eggs get fertilized by two different sperm.
So two separate events.
Exactly. And then there's a really rare one called polar body twinning, where an egg splits before it's even fertilized, and then both halves get fertilized by different sperm.
Wow. So many different ways to make multiples.
Yeah.
We've talked about the challenges of multiple pregnancies, but it must be an amazing experience too.
It absolutely is. I mean, you get double or triple or even more love, laughter, and those challenges we talked about.
Yeah.
Parents of multiples often become pros at organization and multitasking, and the bond between them and their children is just incredible.
It's a unique and special journey, for sure. Okay, so let's move on to a topic that's always a bit mysterious, the onset of labor. What actually starts it?
That's the million-dollar question. We don't know exactly what flips that switch.
Really?
Yeah, but it's most likely a mix of hormones and mechanical changes. Essentially, as the baby gets ready, the uterus stretches and hormones start signaling that it's time.
Amazing. So what are the signs that labor is about to start?
Well, you'll usually start having regular contractions that get more painful, frequent, and intense.
Right.
You might pass the mucus plug.
What?
The mucus plug, it's this thick bit of mucus that seals the cervix.
Oh, okay.
And your water might break.
Right, that's the bigger.
It's like the body's saying, all right, showtime.
The grand finale is approaching. So labor is divided into 3 stages, right? What happens in each one?
You got it. The first stage is all about the cervix opening, or dilating.
Right.
It's split into 2 phases. The latent phase, where the cervix dilates slowly, and the active phase, where it opens up more quickly.
Okay, so the first stage is all about setting the stage.
Exactly.
And then what happens in the second stage?
That's when the cervix is fully dilated, and it's time for the baby to make its grand entrance.
The pushing stage.
Exactly. The mother uses her abdominal muscles to help push the baby through the birth canal.
Wow, so much hard work.
It is, but also incredibly rewarding. And then, of course, we have the third stage, which is all about delivering the placenta.
Right, so the uterus is still contracting to help separate the placenta from the uterine wall.
That's right. And the doctor or midwife might gently pull on the umbilical cord to help things along.
So it's the grand finale of the whole process, with the placenta taking its final bow.
I like that. A perfect way to describe it.
Now, we talked about active management of the third stage of labor earlier. Why is that so important?
It's all about reducing the risk of postpartum hemorrhage. So, giving those uterotonics to help the uterus contract and making sure that whole placenta is delivered are key steps.
Gotcha. So proactive steps to keep things safe.
Yeah.
Now, I know labor can sometimes be super fast. What's that called? Precipitous labor?
Yeah, that's when labor zips by in under 3 hours. And while it might sound nice to have a quick labor, it can actually increase the risk of complications.
Really? Even if it's fast?
Oh yeah, things can happen too quickly. There's a higher risk of tears, hemorrhage, and even fetal distress.
Wow. So speed isn't always a good thing?
Not always, no. On the flip side, sometimes labor can be really slow or even stall completely.
What happens then?
That's called prolonged labor or failure to progress.
Yeah.
And it can happen for a few reasons. Maybe the baby's too big or in a weird position, or maybe the cervix isn't cooperating.
So many things can cause a holdup. How is that managed?
It depends what the culprit is. We might use oxytocin to make the contractions stronger, give pain meds to help mom relax, or in some cases, a cesarean section might be necessary.
So a tailored approach based on what's going on. Now, I remember reading about shoulder dystocia. What is that?
Shoulder dystocia is when, after the baby's head is born, the shoulder gets stuck behind the mother's pubic bone.
Oh, no.
Yeah, it's rare, but it's a serious complication that needs to be addressed quickly.
What are the risks?
It can cause injury to the baby's nerves or bones.
Oh, gosh.
And in some cases, it can even be fatal.
That's scary. How do they handle that situation?
It requires the healthcare provider to think fast and do some skilled maneuvers to free the shoulder and deliver the baby as quickly and safely as possible.
It's like a high-pressure moment.
It definitely is. Another complication we need to talk about is cord prolapse.
Cord prolapse. What's that?
That's when the umbilical cord slips down into the vagina before the baby's head.
Oh, wow. That doesn't sound good.
It's not. It's a major problem because it can compress the cord, cutting off the baby's oxygen supply.
Oh, no. So it's basically an emergency.
Absolutely. We need to relieve that pressure right away.
How do they do that?
They might try to push the baby's head back up or put the mother in a knee-chest position.
Okay.
But usually an emergency C-section is needed to deliver the baby quickly and safely.
Wow. So it's all about quick action in that situation. We've talked about a lot of complications during labor, but are there any that can happen after the baby's born besides postpartum hemorrhage?
Yeah, unfortunately there are. Infection, blood clots, mood disorders, and breastfeeding problems are all possibilities.
Oh, wow. So there's still a lot to be mindful of after the baby arrives.
Definitely. But there are things you can do to lower those risks. Good hygiene, getting up and moving around as soon as you can, getting enough pain relief, having emotional support.
All those things make sense.
And of course, keeping a close eye out for any signs of trouble.
Right. Now, let's talk about postpartum infections specifically. Are there different types?
Yes. It can happen in a few places: the uterus, the bladder, the kidneys, even the breasts.
Wow. So many places. How do they usually happen?
It's usually from bacteria getting into the body, either through the vagina, the urinary tract, or sometimes through a wound like an episiotomy.
Yikes. So what are the signs and how is it treated?
You might have a fever, chills, belly pain, maybe some funky smelling discharge or pain when you pee. And if it's mastitis, you'll probably have breast pain and redness.
Sounds awful.
Yeah, it's definitely not fun. But the good news is it's usually treated with antibiotics and pain meds.
Okay, good to know. And you also mentioned blood clots. What kinds can happen after childbirth?
There are two main types. One is deep vein thrombosis, or DVT, where a clot forms in a deep vein, usually in the legs.
Oh, I've heard of that.
The other is pulmonary embolism, or PE, which is when that clot travels from the legs to the lungs.
That sounds serious.
It is, and it's why it's so important to know the risk factors.
What are they?
Things like having a C-section, prolonged bed rest, obesity, smoking, and a history of blood clots can all increase the risk.
Okay, so lots of things to be aware of.
Yeah, and if you notice any symptoms, like pain, swelling, or redness in your legs, or shortness of breath, you should seek medical attention right away.
Right. Always better to be safe than sorry. Now, mood disorders after childbirth, that's something I don't think we talk about enough.
I agree. It's so common, but there's still a lot of stigma around it.
What are the different types?
There are the baby blues, which are like a milder form of depression that usually goes away on its own in a few weeks.
Okay.
But there's also postpartum depression, which is more serious and needs treatment.
Right.
And the rarest, but most severe, is postpartum psychosis, which requires immediate medical attention.
Oh, wow. That sounds scary.
It is. And it's thought to be caused by a mix of things: all the hormonal changes going on, lack of sleep, the stress of being a new parent, and even social factors.
Makes sense. It's a huge life change. So what are the symptoms of these mood disorders and how are they treated?
It can vary, but look out for sadness, anxiety, extreme tiredness, trouble sleeping, loss of appetite, difficulty bonding with the baby, and any thoughts of harming yourself or the baby.
Oh, gosh, that's a lot.
It is, and it's important to remember that it's not your fault, and help is available. Treatment usually involves therapy, support groups, and sometimes medication.
So a multifaceted approach.
Exactly. Okay, let's talk about breastfeeding issues. We talked a bit about lactation already, but what are some specific problems that can come up?
Right. Like beyond just not producing enough milk.
Exactly. So there can be latch difficulties, sore nipples, breasts that get overly full. That's called engorgement.
Okay.
There's mastitis, which is an inflammation of the breast tissue. And then, of course, there's the issue of low milk supply.
It seems like there's so many potential hurdles when it comes to breastfeeding.
There can be, yeah. But again, support is out there. Lactation consultants are amazing resources.
They really are.
They can help with latch techniques, positioning, and even offer tips for managing engorgement and mastitis. Sometimes medications are needed, like for mastitis or to increase milk production.
It's great that there are experts to help with that.
hmm
Okay, let's move on to prenatal testing. What kinds of tests are there, and what do they tell us?
Prenatal testing is all about checking on the developing baby's health and looking for any potential issues. There are two main types: screening tests and diagnostic tests.
Okay, so what's the difference?
Screening tests give you an idea of the risk for certain conditions,
Okay.
and diagnostic tests can confirm or rule out a specific diagnosis.
Got it. What are some examples of the screening tests?
Well, there's first trimester screening, which uses blood tests and ultrasound to look for chromosomal abnormalities like Down syndrome.
Okay.
Second trimester screening, sometimes called the quad screen, which involves blood tests to measure certain hormone and protein levels.
Right.
And then there's cell-free DNA testing, which is a blood test that analyzes fetal DNA in the mother's blood to screen for chromosomal problems. That one's non-invasive.
Wow, so many options. And what about the diagnostic tests?
So there's chorionic villus sampling, or CVS, where they take a sample of placental tissue,
Okay.
amniocentesis, which takes a sample of amniotic fluid,
Gotcha.
and then there's fetal echocardiography, a special ultrasound that checks the baby's heart for any structural problems.
So those are the more in-depth tests.
Right, they provide more definitive answers, but they do carry some risks too.
So how do doctors decide which tests to recommend?
It's a combination of things: the patient's age, their medical history, family history, and any red flags from the screening tests all play a role.
So it's really personalized.
Absolutely. The healthcare provider should talk through the pros and cons of each test with the patient so they can make an informed decision.
That's good. Okay, now let's talk about genetic testing. That seems like a whole other world.
It is. Genetic testing analyzes a person's DNA to find any changes or mutations that might be linked to diseases or conditions.
So you can see if you might be predisposed to certain things.
Exactly. And there are different types of genetic tests, like carrier screening to see if someone carries a gene for a recessive disorder, predictive testing to assess the risk of developing a condition later in life, and diagnostic testing to confirm or rule out a specific genetic condition.
Wow, so much information you can get from your genes. Are there any ethical issues surrounding genetic testing?
Definitely. Informed consent is a big one,
Of course.
but also privacy concerns, potential for discrimination, and even the emotional impact of learning this information.
Yeah, that makes sense.
It's crucial to make sure people really understand the implications of the results before they get tested.
Absolutely. Okay, last but not least, let's talk about family planning.
Okay.
There are so many different methods out there, it can be overwhelming.
There are a lot, that's for sure. We can break them down into hormonal methods, barrier methods, natural family planning, and sterilization.
Okay, so what are some of the hormonal options?
You've got the combination pill, the progestin-only pill, sometimes called the mini pill,
Right.
patch, the ring, the implant, and the injectable.
Those are the main ones, right? How do they work?
They basically either stop ovulation or thicken the cervical mucus so sperm can't reach the egg.
Smart. Okay, so we've got hormones blocking things. What about barrier methods?
Barrier methods are pretty straightforward. You've got the male condom, the female condom, the diaphragm, and the cervical cap. They all create a physical barrier to prevent sperm from getting into the uterus.
Okay, that makes sense. What about natural family planning? How does that work?
That's all about tracking the woman's menstrual cycle and figuring out when she's most fertile.
So it's like calendar-based.
Kind of, but it involves more than just looking at a calendar. It involves tracking things like basal body temperature and cervical mucus changes.
Okay, interesting. And then there's sterilization, the permanent option.
Right. Sterilization is a permanent method. For women, it's called a tubal ligation, where the fallopian tubes are blocked or cut.
Right?
And for men, it's a vasectomy, where the tubes that carry sperm are blocked or cut.
Got it. So lots of options to choose from depending on your circumstances and preferences. We've covered so much in this deep dive, from the stages of labor to postpartum challenges, prenatal testing, and even family planning. It's amazing how much there is to learn about obstetrics.
Absolutely. It's a fascinating field that's constantly evolving.
You know, one thing that struck me as we were going through all this material is how interconnected everything is. Like from the anatomy of the pelvis to the physiology of labor, every detail seems to matter.
It's true. Everything has to work together perfectly for pregnancy and childbirth to go smoothly.
Speaking of the pelvis, I remember reading about the posterior sagittal diameter in the excerpts, but I'm not quite sure I understand what it is.
Yes. The posterior sagittal diameter, that's a measurement of the pelvic outlet.
Go what now?
The pelvic outlet. It's basically the bony opening that the baby has to pass through during delivery.
So it's like the exit door.
Exactly. And the posterior sagittal diameter measures the distance between the sacrum and the ischial tuberosities.
Okay, so it's basically measuring how much space there is for the baby's head to come out.
You got it. And this measurement is super important because if it's too small, it can make vaginal delivery really difficult or even impossible.
Oh, wow. That makes sense.
Yes.
So it's another key factor in determining if a vaginal birth is possible.
Definitely. We talked about how the fetal skull can mold to fit through the birth canal, but the baby's position also plays a big role.
Right, like if they're head down or breech.
Exactly. But even beyond that, the position of the baby's head itself, called the fetal attitude, can impact the delivery.
So what's the ideal position?
The best position is for the baby's chin to be tucked down towards its chest. This creates the smallest possible diameter for the head to pass through.
Interesting. It's like aerodynamics for babies.
Uh-huh. I like that. Now, let's jump back to those first few weeks after birth, the postpartum period. We talked about lochia, that vaginal discharge after delivery, but how long does it usually last?
Yeah, what exactly is it made of?
Good questions. So lochia is a mix of blood, mucus, and tissue from the lining of the uterus that's shedding.
Okay, so it's like the uterus cleaning house.
Exactly. And it usually lasts for a few weeks, gradually decreasing in amount and changing color, from bright red to pink to white.
Okay, so that's normal.
Totally normal. But there are a few things to watch out for.
Like what?
Heavy bleeding, any foul smell, or a sudden increase in bleeding can all be signs of a problem, like an infection.
Gotcha. So pay attention to any changes and call the doctor if anything seems off.
Absolutely. Now, we touched on postpartum hemorrhage earlier, but I think it's worth breaking down the different types.
Okay, yeah. What's the difference between primary and secondary postpartum hemorrhage?
The timing is the key difference. Primary postpartum hemorrhage happens within 24 hours of delivery, while secondary PPH occurs between 24 hours and 6 weeks after delivery.
So it's all about when it happens. And what are the usual causes?
The most common culprit for both is uterine atony, which is basically when the uterus doesn't contract properly after the baby's born.
Okay, so the uterus isn't clamping down like it should.
Right. But there can be other causes too, like pieces of the placenta getting left behind, tears in the genital tract, or even bleeding disorders.
So it's important to figure out what's causing the bleeding to treat it properly.
Definitely. And prevention is key too. Active management of the third stage of labor with those uterotonics we talked about can really lower the risk of PPH.
It's good to have those proactive measures in place.
Yeah.
Now, there's a condition called uterine inversion that sounds really scary. What exactly is that?
It's definitely one of the more dramatic complications. Uterine inversion is when the uterus literally turns inside out, either partially or completely.
Wow, that sounds intense. What causes it?
It can happen if someone pulls too hard on the umbilical cord before the placenta has separated, or if the uterus is just really weak and not contracting well.
Okay.
Things like a large placenta, a short umbilical cord, or forceful attempts to deliver the placenta can increase the risk.
So how do they fix that?
It's a medical emergency, so the healthcare provider needs to act quickly and push the uterus back into its normal position.
Wow. Talk about pressure.
I know, right?
Yeah.
Sometimes they need meds or even surgery to help get it back where it belongs.
Yeah.
Now let's circle back to lactation problems. What are some common reasons why mothers might have trouble breastfeeding?
Yeah, we talked about the hormones involved, but what can go wrong?
Well, the baby might have trouble latching on properly.
Okay.
Sore nipples are common, especially in the beginning.
I can imagine.
And sometimes there just isn't enough milk being produced.
So it's not always a simple process.
Definitely not.
Yep.
And sometimes there are medical conditions on the mother's side that can interfere with lactation.
So what can be done to help in those situations?
Lactation consultants are a lifesaver. They can give expert advice on latch techniques, positioning, and ways to increase milk supply.
So it's worth reaching out to them if you're struggling.
Absolutely. They can make a world of difference. Now, gestational diabetes, that's a condition that only happens during pregnancy, right?
Yes. But what exactly is it?
It's a type of diabetes that develops during pregnancy when the body can't produce enough insulin to handle the increased demands.
So the body's not keeping up with its own needs.
Exactly. And it can lead to complications for both the mother and baby, like preeclampsia, preterm labor, and even having a really large baby that's called macrosomia.
So it's definitely something to take seriously. How do they diagnose and treat it?
Usually, they'll do a glucose tolerance test during the second trimester.
Okay,
And if it's positive, treatment involves monitoring blood sugar, making dietary changes, and sometimes taking insulin.
got it.
Yeah.
Now, we've talked about preeclampsia and eclampsia, which are hypertensive disorders, but are there other types that pregnant women can experience?
You can have chronic hypertension, which means you had high blood pressure before you even got pregnant.
Okay.
And then there's gestational hypertension, which develops after 20 weeks of pregnancy.
So you didn't have it before, but now you do.
Exactly. And it's important to note that gestational hypertension doesn't involve proteinuria, which is a key feature of preeclampsia.
Got it. So how are these different hypertensive disorders managed during pregnancy?
The management really depends on how high the blood pressure is and if there are any other complications.
Okay.
It might involve just monitoring the blood pressure, making some lifestyle changes, or taking medications to lower it.
So personalized approach again.
It's all about finding what works best for each individual situation. We've covered so much today: normal postpartum recovery, complications like PPH and uterine inversion, lactation problems, gestational diabetes, and now hypertensive disorders.
That's a lot to take in.
It is. But I think it highlights just how complex and multifaceted pregnancy and childbirth can be. But before we wrap up this part, there's one crucial aspect of obstetric care that I think we need to touch on:
What's that?
the ethical considerations. I mean, obstetrics is a field where you constantly encounter ethical dilemmas.
Like what kinds of dilemmas?
All sorts. Issues around informed consent, respecting the patient's wishes, fetal rights, even how to allocate limited resources.
Yeah, I can see how those would come up.
For example, there might be disagreements about whether a certain intervention is the right choice, how to manage a high-risk pregnancy, or even whether it's ethically permissible to terminate a pregnancy when the fetus has a serious anomaly.
Those are heavy topics.
They are, and there are no easy answers. But I think it's important to have open and honest conversations about these issues.
Definitely. So how do healthcare providers navigate those ethical challenges?
Communication is key. The healthcare provider, the patient, and sometimes other people involved, like family members or even an ethics committee, need to talk openly and honestly.
So a collaborative approach.
Exactly. The goal is to find a solution that respects everyone's values and beliefs while also doing what's best for both the mother and the baby.
I like that. Okay, let's shift gears and talk about a topic that's been generating a lot of ethical discussion: assisted reproductive technologies.
Ah, yes, things like IVF.
Right. What are some of the ethical concerns there?
Well, there's the issue of access to these treatments, who can afford them, who should have access.
Right, it could be very expensive.
Exactly. Then there's the potential for multiple births, which comes with its own set of risks.
Okay.
And then you have the ethical considerations around using donor eggs or sperm and what to do with any extra embryos that are created during the process.
So it's a whole new set of ethical challenges.
It is. And it's important to have clear guidelines and regulations in place to provide counseling to patients so they understand all the implications and to encourage open discussion about the potential benefits and risks of these technologies.
Agreed. It's a rapidly evolving field, so those discussions need to keep happening. Now, let's circle back to multiple pregnancies. We touched on some of the risks, but I'd love to dig a little deeper into what makes them so challenging.
Sure. So multiple pregnancies just inherently carry a higher risk of complications for both mom and babies.
Like we talked about before, with preeclampsia and preterm labor.
Exactly. But there's also a higher risk of gestational diabetes, problems with the baby's growth, and even congenital anomalies.
Oh, wow. I didn't realize there was a connection to birth defects.
Yeah, unfortunately there is. And sadly, the rate of infant mortality is also higher with multiple births.
That's heartbreaking. So it's a lot for both the parents and the medical team to handle.
Absolutely. Managing multiple pregnancies is a delicate balancing act. You're trying to meet the needs of multiple fetuses while also ensuring the mother's health and well-being.
Right. It's like a double or triple or even quadruple responsibility.
That's a good way to put it. Monitoring fetal growth, amniotic fluid levels, and the mother's health is crucial.
It's a lot of close monitoring.
Tons of it. And then there are the big decisions about timing and delivery method, which can be a lot more complex with multiples. And of course, the risks during labor and delivery are higher too.
So much to consider. Now, you mentioned twin-to-twin transfusion syndrome earlier, which can happen with identical twins. Can you explain a bit more about what that is and how it's managed?
Of course. So TTTS is a rare but serious condition that can happen when identical twins share a placenta.
Okay.
It happens when there is an imbalance in the blood flow between the twins, with one twin, the recipient twin, getting too much blood, and the other twin, the donor twin, not getting enough.
So it's like one twin is taking more than their share.
In a way, yes, and this can lead to all sorts of problems. The recipient twin might have too much fluid around them, their heart might be overworked, and they might be significantly bigger than the donor twin.
Oh, whoa, whoa.
And the donor twin might not be growing as well because they're not getting enough nutrients and oxygen.
That sounds really serious.
It is, and it's why early diagnosis and treatment are so important. If TTTS is caught early enough, there are procedures that can help.
Like what?
Well, they can drain some of the excess fluid from around the recipient twin. That's called amnioreduction.
Okay.
They can use lasers to seal off some of the blood vessels that are connecting the twin circulations.
Wow, lasers.
Yep, pretty high tech. And in some cases, they might even recommend selective reduction.
What's that?
It's basically terminating one twin's pregnancy to give the other twin a better chance of survival.
That must be such a difficult decision.
It is incredibly difficult,
Right.
but sometimes it's the best option for ensuring at least one baby survives.
Yeah.
Now, we also talked about vanishing twin syndrome earlier. Can you remind me what that is?
Sure, it's when one twin disappears during the pregnancy.
Exactly. Usually, this happens very early on in the first trimester, and it's thought to be caused by one of the twins miscarrying.
So it's like a silent loss.
You could say that.
Yeah.
And often, the mother might not even know it happened. The body just reabsorbs the tissue.
Wow. How do they even know it happened then?
It's usually detected on an ultrasound. They might see 2 gestational sacs at first, but then only one continues to develop.
So an ultrasound can reveal a lot about what's going on in there.
It's an amazing tool. Now, before we move on, I want to quickly touch on the different ways twins can occur.
Okay, yeah. I know there are identical and fraternal, but are there other types?
There are. Identical twins, also called monozygotic twins, happen when a single fertilized egg splits into 2 embryos.
Right, so they have the same DNA.
Exactly. Then you have fraternal twins, or dizygotic twins, which happen when 2 separate eggs are fertilized by 2 different sperm.
So it's like having 2 siblings who happen to be born at the same time.
A good way to think about it. And then there's a really rare type called polar body twinning, where an egg actually splits before fertilization, and then both halves are fertilized by different sperm.
Wow, I've never heard of that one.
It's pretty rare, but it does happen. So yeah, there are multiple ways to end up with multiples. And while we've talked a lot about the challenges of having twins or more,
Right.
it's also an incredibly special experience. I mean, imagine the joy of having 2 or more babies at once.
Oh, I can only imagine.
And while there's definitely more work involved, the love and the bond between those babies and their parents is just amazing to witness.
It's a unique and rewarding journey for sure. Okay, so let's talk about the big event labor. What triggers it, and how do you know when it's about to start?
The exact trigger for labor is still a bit of a mystery.
Really? After all these years, we still don't know.
It's a complex process, but we know it involves a combination of hormonal changes and mechanical factors.
Okay, so the baby is ready and the body is like, let's go.
Exactly. The baby reaches a certain point of maturity, the uterus starts stretching, and hormones like oxytocin and prostaglandins start signaling that it's time.
Okay, so what signs should women look out for?
The most obvious sign is contractions. You'll start feeling regular, painful contractions that gradually get closer together and stronger.
Gotcha.
You might also pass your mucus plug.
That sounds kind of gross.
It can be a bit, yeah. It's basically this thick plug of mucus that seals the cervix during pregnancy.
Right.
And when it comes out, it can be a sign that labor is getting closer.
Okay, good to know.
What else? And of course, there's the big one, your water breaking.
Right. That's when the amniotic sac ruptures.
Exactly. It doesn't always happen dramatically like in the movies, but it's definitely a sign that labor is imminent.
Okay, so you've got those contractions, the mucus plug, and the water breaking. Those are the main signs.
Those are the big ones. And once those start happening, it's time to head to the hospital or birthing center.
Exciting and nerve-wracking all at the same time. Now, we know labor is divided into 3 stages. Can you remind me what those are?
Absolutely. The first stage is all about the cervix opening up or dilating. It's actually divided into 2 phases. The latent phase, where the cervix dilates slowly from 0 to about 3 centimeters.
Okay.
And then the active phase, where things speed up a bit, and the cervix dilates from 3 to 10 centimeters.
10 centimeters. That's when the baby can actually come out, right?
Exactly. So the first stage is all about preparation, getting everything ready for the main event.
Makes sense. And then what happens in the second stage?
That's when the pushing starts.
The big show.
Exactly. The cervix is fully dilated, and the mother uses her abdominal muscles to help push the baby down and out through the birth canal.
Wow, that must be so much work.
It is definitely the most physically demanding part of labor, but it's also incredibly
I
rewarding.
can only imagine. And then the third stage.
The third stage is all about delivering the placenta.
Right, that's important too.
Absolutely. After the baby is born, the uterus continues to contract to help separate the placenta from the uterine wall,
Okay.
and the doctor or midwife might gently pull on the umbilical cord to help deliver it.
So it's like the final curtain call.
Exactly. We talked about active management of the third stage earlier, but I think it's worth emphasizing how important that is.
Okay, remind me what that involves.
It's all about reducing the risk of postpartum hemorrhage. So we give medications to help the uterus contract strongly, and we carefully inspect the placenta to make sure it's all there and that nothing is left behind.
Okay, so it's a proactive approach to prevent complications.
Exactly. Now, we know labor doesn't always go according to plan.
Right.
Sometimes things happen much faster than expected. That's called precipitous labor.
That's when it's super fast, right? Under 3 hours.
Exactly. And while it might sound appealing to get it over with quickly,
Yeah, who wouldn't want that?
I know, right?
Yeah.
But it can actually increase the risk of problems for both the mother and the baby.
Really? Like what kinds of problems?
Well, there's a higher risk of tears, especially in the perineum.
Okay.
The mother might have a harder time controlling the pushing, which can lead to more severe tearing. And there's also a higher risk of postpartum hemorrhage because the uterus might not have time to contract properly.
Okay, so things need time to adjust.
Exactly. And then for the baby, there's a risk of fetal distress if the labor is too fast.
So the baby can have trouble keeping up with the rapid pace.
Exactly. So while a quick labor might sound appealing, it's not always ideal.
Makes sense. Now, on the other end of the spectrum, what about when labor is super slow or even stops completely?
That's called prolonged labor or failure to progress. And it can happen for a number of reasons.
Like what?
Sometimes the baby is just too big or it's in a position that makes it difficult to come out.
Right.
Sometimes the cervix isn't dilating as it should, or maybe the contractions just aren't strong enough.
So it's like hitting a roadblock.
Yeah, exactly. And how we manage it depends on what's causing the delay.
So they have to figure out what's going on first.
Exactly. We might give oxytocin to strengthen the contractions,
Okay.
or offer pain relief medication to help the mother relax, which can sometimes help things progress.
Makes sense.
And in some cases, a C-section might be the safest option.
Right, if nothing else is working. Now, you mentioned shoulder dystocia earlier. Can you explain that a little bit more?
Of course. Shoulder dystocia is a rare but serious complication that happens when the baby's shoulder gets stuck behind the mother's pubic bone after the head is delivered.
Oh, wow, that sounds scary.
It is. And it requires quick action from the healthcare provider.
What are the risks?
Well, it can cause injuries to the baby's nerves or bones.
Oh, no.
And in severe cases, it can even be fatal. But thankfully, most cases are managed successfully.
So what do they do to fix it?
They have to do some special maneuvers to dislodge the shoulder and help the baby be born.
Okay.
It requires a lot of skill and quick thinking, but thankfully most healthcare providers are trained to handle these situations.
It's good to know they're prepared for that. Now, what about cord prolapse? That's another one that sounds pretty frightening.
It is. Cord prolapse happens when the umbilical cord slips down into the vagina before the baby's head.
Oh, wow. Why is that so dangerous?
Because the cord can get compressed,
Meaning?
meaning the baby's oxygen supply can get cut off.
Oh my gosh, that's terrifying.
It is a serious situation. The healthcare provider needs to act quickly to relieve that pressure on the cord.
How do they do that?
They might try to gently push the baby's head back up into the uterus, or they might put the mother in a knee-chest position.
Okay.
But usually an emergency C-section is the safest way to deliver the baby quickly.
So again, it's all about acting fast. We've talked about a lot of potential complications that can happen during labor. But what about after the baby is born? Are there other postpartum complications besides hemorrhage that women should be aware of?
Yes, unfortunately there are. Postpartum infections,
Right.
blood clots, mood disorders, and breastfeeding problems are all possibilities.
So even though the baby is here, there's still a lot to be aware of.
Absolutely. The postpartum period is a time of healing and adjustment, and it's important to be mindful of those potential complications.
What can women do to lower their risk of these complications?
Well, good hygiene is essential.
Okay, that makes sense.
Getting up and moving around as soon as you can after delivery helps too.
Okay.
Making sure you're getting adequate pain relief,
Right.
having good emotional support from your partner, family, and friends,
Well, important things.
and of course being aware of the signs and symptoms of potential problems so you can seek medical attention promptly.
So it's a combination of taking care of yourself physically and emotionally.
Exactly.
Yeah.
Now let's talk about postpartum infections in a bit more detail. Where can these infections happen?
Yeah, what are we talking about here?
Well, they can happen in the uterus, that's called endometritis.
Okay.
They can happen in the bladder, that's cystitis.
Right.
They can even happen in the kidneys, that's pyelonephritis.
Oh, wow. So in a lot of different places.
Yeah. And they can also happen in the breasts, that's mastitis.
So many potential trouble spots. What causes these infections?
Usually it's bacteria that gets into the body.
Okay.
It can get in through the vagina, the urinary tract, or sometimes even through a wound, like an episiotomy or a C-section incision.
So it's important to keep those areas clean.
Absolutely. Hygiene is key. So what are the signs of a postpartum infection?
Yeah. What should women look out for?
Well, fever and chills are common.
Okay.
You might also have pain in your abdomen,
Okay.
and you might have a discharge that smells bad. If you have a bladder infection, you might have pain or burning when you pee. And if you have mastitis, your breasts will probably be sore and red.
Okay. So lots of different symptoms depending on where the infection is.
Right. But the good news is that most postpartum infections are treatable with antibiotics.
That's good to know. And what about blood clots? What types of blood clots can happen after childbirth?
There are two main types that we worry about. One is deep vein thrombosis, or DVT, which is when a blood clot forms in a deep vein, usually in the legs.
Okay.
And the other is pulmonary embolism, or PE, which is when a DVT breaks loose and travels to the lungs.
Oh, wow. That sounds serious.
It is. It's a very serious condition.
Yeah.
So it's important to know the risk factors.
Okay. What are they?
Well, having a C-section increases the risk. Okay.
Prolonged bed rest, obesity, smoking, and having a personal or family history of blood clots are also risk factors.
So it's a combination of things.
Exactly. And if you notice any symptoms like pain, swelling, or redness in your legs, or if you have shortness of breath, you should seek medical attention right away.
Right. Better safe than sorry.
Yeah.
Now, let's talk about postpartum mood disorders. I think this is something that a lot of women experience but might not feel comfortable talking about.
I agree. There's still a lot of stigma around it, but it's incredibly common.
What are the different types of mood disorders that can happen after childbirth?
There are three main ones. There's the baby blues, which is a mild form of depression that usually goes away on its own within a couple of weeks after delivery.
Okay.
Then there's postpartum depression, which is more serious and longer lasting.
Right.
And then there's postpartum psychosis, which is the rarest but most severe type.
Oh, wow. That sounds scary. It is. Postpartum psychosis can cause hallucinations, delusions, and even thoughts of harming yourself or the baby. It's a medical emergency that requires immediate treatment.
Okay, so it's important to know the difference between those three.
Absolutely. Now, we think these mood disorders are caused by a combination of factors.
Like what?
Well, there's the hormonal roller coaster that happens after delivery.
Right, the hormones are going crazy.
Exactly. And then there's the sleep deprivation that comes with having a newborn.
Yeah, I can imagine that's a huge factor.
It is. And then there's the stress of adjusting to life as a new parent.
That's a big one.
It is. And then there are social factors like lack of support or unrealistic expectations from society.
So it's a combination of physical, emotional, and social factors.
Exactly. It's important to remember that postpartum mood disorders are not your fault, and they are treatable.
Right. Don't be afraid to reach out for help.
Absolutely. If you're experiencing any of the symptoms we talked about, please talk to your doctor or midwife.
Okay, good advice. Now let's talk about breastfeeding problems. We've already discussed lactation, but what are some specific problems that women might encounter when breastfeeding?
Sure. So common problems include difficulty with the baby latching on properly, sore nipples, engorgement, mastitis, and low milk supply.
Wow, that's a lot of potential issues.
It is, but thankfully there are things that can help.
Like what?
Well, working with a lactation consultant can be incredibly helpful. They can help with latch techniques, positioning, and ways to increase milk supply.
Mhm.
And sometimes medications are needed, like for mastitis or to help boost milk production.
So there's support available for women who are struggling with breastfeeding.
Absolutely. Now, let's switch gears and talk about prenatal testing. What are the different types of prenatal tests available, and what information do they provide?
Okay.
Prenatal testing is all about assessing the health of the developing baby and looking for any potential problems. There are two main categories of tests: screening tests and diagnostic
Okay,
tests.
so what's the difference between those two?
Screening tests are done to assess the risk of certain conditions, while diagnostic tests are done to confirm or rule out a specific diagnosis.
Got it. So screening tests are like a first step.
Exactly. They can help identify pregnancies that might be at higher risk for certain problems.
Okay, what are some examples of screening tests?
Well, there's first trimester screening, which combines blood tests and ultrasound to assess the risk of chromosomal abnormalities like Down syndrome.
Right.
Then there's second trimester screening, sometimes called the quad screen, which is a blood test that measures the levels of certain hormones and proteins.
Okay.
And then there's cell-free DNA testing, which is a newer, non-invasive blood test that analyzes fetal DNA in the mother's blood to screen for chromosomal abnormalities.
Wow, that sounds pretty high tech.
It is, and it's becoming increasingly popular because it's very accurate and doesn't carry any risk to the baby.
Okay, that makes sense.
Well,
What about diagnostic tests?
So diagnostic tests are done when we need to get a definitive answer about a specific condition.
Okay, what are some examples of those?
Well, there's chorionic villus sampling, or CVS, which is a procedure where they take a sample of placental tissue.
Uh,
And then there's amniocentesis, which is a procedure where they take a sample of amniotic fluid.
right.
Both of these tests can be used to diagnose chromosomal abnormalities, genetic disorders, and other fetal conditions.
But
Are more invasive than screening tests, so they do carry a small risk of complications.
right, so they're not done routinely.
Exactly. They're usually only offered when there's a specific reason to believe there might be a problem.
Okay, that makes sense. So how do doctors decide which tests are appropriate for each patient?
It's a collaborative decision-making process. The doctor will consider the patient's age, medical history, family history, and the results of any screening tests they've already had.
Okay.
And then they'll discuss the risks and benefits of each test with the patient so they can make an informed choice together.
So it's a personalized approach, just like with everything else in obstetrics.
Absolutely. Now let's talk about genetic testing. It's a fascinating field that's becoming increasingly important in prenatal care.
It is, but it can also be a bit confusing.
I agree. There are so many different types of genetic tests, and it can be hard to keep them all straight.
Okay, so break it down for me. What are the different types of genetic tests available, and what do they tell us?
Sure. So genetic testing basically involves analyzing a person's DNA to look for changes or mutations that might be linked to certain diseases or conditions.
Okay.
There are different types of tests depending on what information we're looking for.
Okay, give me some examples.
One type is carrier screening, which is done to see if someone carries a gene for a recessive disorder.
Okay.
So even if they don't have the disorder themselves, they could pass the gene on to their children.
Right.
Another type is predictive testing, which is done to assess someone's risk of developing a genetic condition later in life.
Okay.
And then there's diagnostic testing, which is done to confirm or rule out a specific genetic condition.
Gotcha. So you can get a lot of different information from genetic testing.
You can. But it's important to remember that genetic testing isn't always black and white.
Meaning?
Well, sometimes a test might reveal a gene that increases the risk of a certain condition, but it doesn't mean that the person will definitely develop that condition.
Okay.
And sometimes genetic testing can raise more questions than it answers.
Right. I can see how that could be overwhelming.
It definitely can be. That's why it's so important to have genetic counseling before and after testing.
So you can really understand what the results mean and what your options are.
Exactly. Now, let's switch gears and talk about family planning. There are so many different methods of contraception available these days.
There are. It can be hard to know where to start.
I agree. But that's a good thing. It means there are more options than ever before to help people plan their families.
Right. So can you break down the different categories of contraception?
Sure. We can broadly divide them into hormonal methods, barrier methods, natural family planning, and sterilization.
Okay, let's start with hormonal methods. What are some examples of those?
The most common one is the combined oral contraceptive pill, or the pill for short.
Right, I've heard of that one.
It contains both estrogen and progestin,
Okay.
and it works by preventing ovulation.
Okay, so the ovaries don't release an egg.
Exactly. Then there's the progestin-only pill, sometimes called the mini pill.
Yep.
It only contains progestin, and it works by thickening the cervical mucus to make it harder for sperm to reach the egg.
Interesting. So it creates a barrier, but it's a hormonal barrier.
You got it. There are also other hormonal methods like the patch, the vaginal ring, the implant, and the injectable.
Okay, so lots of different ways to deliver those hormones.
Exactly. And they all work in slightly different ways, but the goal is the same, to prevent pregnancy.
Makes sense. What about barrier methods?
Barrier methods are pretty straightforward. They physically block sperm from entering the uterus.
Okay.
The most common one is the male condom, which is a thin sheath that's worn over the penis. There's also the female condom, which is a pouch that's inserted into the vagina.
Okay.
And then there are the diaphragm and the cervical cap, which are both dome-shaped devices that are inserted into the vagina to cover the cervix.
Got it. So it's all about creating a physical barrier to prevent those sperm from getting through.
Exactly. Now, what about natural family planning? How does that work?
Yeah, that one always seemed a bit mysterious to me.
It's actually pretty simple. Natural family planning or fertility awareness-based methods involve tracking the woman's menstrual cycle and identifying her fertile window.
Okay, so you're basically figuring out when you're most likely to get pregnant.
Exactly. And then you either abstain from intercourse during that time or use a barrier method.
Okay, so it requires a lot of awareness and discipline.
It does. But for some couples, it's a good option. And then, of course, there's sterilization.
Right, the permanent option.
Exactly. Sterilization is a surgical procedure that makes someone permanently unable to have children.
Okay, so how does that work?
For women, it's called a tubal ligation, where the fallopian tubes are blocked or cut.
Okay.
And for men, it's called a vasectomy, where the vas deferens, which are the tubes that carry sperm, are blocked or cut.
Got it. So no more sperm or eggs can travel to where they need to be.
Exactly. Sterilization is a big decision, obviously, but it's a very effective method of contraception for those who are certain they don't want any more children.
Absolutely. Wow, we've covered so much in this deep dive into the world of obstetrics. It's been an incredible journey, exploring everything from the anatomy of the pelvis to the complexities of labor and delivery, from the challenges of postpartum recovery to the ethical considerations surrounding assisted reproductive technologies.
I agree, it's been quite a ride, but I think it highlights just how fascinating and multifaceted this field really is.
It does. We've learned about the incredible resilience of the human body and the amazing ways it adapts to the challenges of pregnancy and childbirth.
Absolutely. And we've explored the many advances in medical technology and knowledge that have helped make pregnancy and childbirth safer for both mothers and babies.
We've also touched on some of the ethical dilemmas that arise in this field and the importance of open communication and shared decision-making between healthcare providers and their patients.
It's a field that's constantly evolving, and there are always new challenges to face. But it's also incredibly rewarding as we get to witness the miracle of life unfolding right before our eyes.
I couldn't agree more. Well, I think it's time to wrap up this deep dive. We've covered so much ground, and I hope our listeners have a better understanding of the amazing world of obstetrics.
I hope so too. And I hope they feel empowered to ask questions, advocate for their health, and make informed decisions about their reproductive journeys.
Absolutely. Remember, you're not alone on this journey. There are countless resources available, from healthcare providers to support groups and online communities ready to offer guidance and support every step of the way.
Exactly. So keep learning, keep asking questions, and keep celebrating the miracle of life.
From all of us here at The Deep Dive, thanks for joining us.